Welcome to our educational video on Neoplasia Part 3. We will discuss about the metastases in this video. What is metastases? Metastases is defined as spread of tumor by invasion in such a way that discontinuous secondary tumor masses are formed at the site of lodgement. So the primary tumor at the site of origin gets separated and gets lodged into other various sites in the body, forming secondary tumors. The two most important features to distinguish malignant from benign tumor are metastases and invasiveness. The benign tumors neither show metastases nor local invasion, while the malignant tumors show metastases and local invasion. However, all malignant tumors can metastasize except gliomas of central nervous system and basal cell carcinoma of the skin. Now let's discuss the various ways of metastases that a tumor can spread. There are three ways by which tumors can spread: the lymphatic spread, hematogenous spread, and spread along body cavities. Generally, carcinomas metastasize through the lymphatic system, while the sarcomas primarily metastasize through the bloodstream but can also spread through the lymphatic system. First, we will discuss about the lymphatic spread. The malignant cells involve the lymphatics in two ways: by forming a continuous growth known as lymphatic permeation, or they can travel as emboli to the next draining lymph node. In lymph node, the tumor cells lodge first in subscapular sinus. The first lymph node in a regional lymphatic that receives lymph flow from primary tumor is called sentinel lymph node. Regional lymph nodes often become involved in cancer metastases. However, not all enlarged lymph nodes indicate metastases, as they can also be caused by tumor-related inflammation. Lymphatic metastasis can occur in unusual sites due to venous lymphatic anastomosis, inflammation, radiation, or retrograde flow. Virchow's lymph node is a common site for abdominal organ cancer metastasis, like in cancer of stomach, colon, and gallbladder. The next type of spread is hematogenous spread. It is most common in sarcomas. The liver, lungs, brain, bones, and kidneys are common sites for metastases due to their favorable environment. Veins are more commonly involved than arteries because veins have thinner walls that can be easily penetrated. Arterial tumor spread is less likely due to thick walls and elastic tissue resistance. Mostly systemic veins drain blood into vena cava, leading to lung metastasis, and the portal veins drain blood into the liver. Mostly cancer metastasize into lung and liver, most commonly in systemic blood and portal blood drainage respectively. Their final way by which tumors can spread is through spread along body cavities. Some cancers may spread by seeding across body cavities and natural passages. These are the ways by which tumors spread: transcoalomic spread, spread along epithelium line surfaces, spread by a cerebrospinal fluid, and implantation. Let's discuss the transcoalomic spread first. In this type of spread, the cancers invade body cavities through the serosal wall, spreading tumor fragments and coalomic fluid. The peritoneal, pleural, and pericardial cavities are affected, and these are some of the examples of transcoalomic spread. The next way of spread is spread along epithelium-lined surfaces. Malignant tumors rarely spread along epithelium-lined surfaces due to resistance. Next, the spread by a cerebrospinal fluid. The malignant tumor of the ependyma and leptomeninges may spread by release of tumor fragments and tumor cells into the CSF and produce metastasis at other sites in the central nervous system. And the last way is transplantation, which is rare. Tumors can spread through surgical instruments or direct contact, or it may be implanted by direct contact, such as transfer of cancer of the lower lip to the opposing upper lip. In this video, we have understood about metastases and different ways of spread of cancer. Now let's discuss how the tumor spreads, or the mechanism of metastases. This mechanism involves 8 steps, as shown. Now let's understand how the metastases occurs. The first step in the mechanism of metastases is clonal proliferation and angiogenesis. The cancer cells spread through aggressive clonal proliferation and angiogenesis. This is explained through tumor heterogeneity. Tumor heterogeneity allows subpopulation of cancer cells to develop the characteristics necessary for metastases. The next step is tumor cell loosening. Normally, the cells remain glued to each other due to presence of cell adhesion molecules. But in epithelial cancers, there is either loss or an activation of E-cadherin and also other CAMs, all of which results in loosening of cancer cells. The next step is tumor cell and extracellular matrix interaction. The leucine cancer cells attach to extracellular matrix proteins facilitated by receptor abundance and integrin loss, promoting invasion. The next step is degradation of extracellular matrix. The tumor cells overexpress S proteases and matrix-degrading enzymes like collagenases and gelatinase, enabling them to dissolve the extracellular matrix and invade surrounding tissues. The next step is entry of tumor cells into capillary lumen. Tumor cells migrate into capillaries or venules after degrading the basement membrane, utilizing mechanisms like autocrine motility factor and matrix component cleavage products. These mechanisms promote tumor cell motility, chemotaxis, growth, and angiogenesis. The next step is thrombus formation. Tumor cells covered with constituents of circulating blood in capillaries form thrombi which nourish and protect them from immune attack. Only small percentage of malignant cells survive in the bloodstream to form metastasis. The next step is extravasation of tumor cells. Tumor cells in the circulation may block and attach to vascular endothelium and invade, exposing the basement membrane and eventually extravasate to extravascular space. And the final step is survival and growth of metastatic deposit. The extravasated malignant cells, after lodging in suitable environment, grow under the influence of growth factors. If the host immune system fails to eliminate these deposits, they can further metastasize to the same organ or other sites. If you found this video helpful, please like, share, and subscribe.